Hey everybody, thanks for tuning in to What's the Buzz live from San Francisco at the QNova LifeSciences Partnership Forum, co-hosted by MTEC. And that's why we're live today with Shawn Green, CEO of MTEC. Shawn, welcome.
Well, thank you, Chris. It's a delight to be here. Delight to team up with QNova.
Yeah, this is exciting. I mean, what the energy today as the healthcare week starts off has just been awesome. The start to the forum was great. It's like 2 hours of really interesting insights coming out. So like we're thrilled to be here, partner with you and the Qnova team to really continue to share the stories and everything that's going on out here this week. And that non-dilutive dollars is something. So just in this morning's sessions, we heard about that, what investors are looking for. They're looking for focus, but they're looking for de-risked, right? They're looking for companies that can capture some of those. And that's been challenging this past year, more so than past. But that is one of those key inflection points or those key variables that we heard, again, throughout some of the talks here at JP Morgan around that. So it sounds like you guys play a key role for some companies in kind of helping to get some of those first phases taken care of.
You mentioned, Chris, a couple points. One, de-risking. Over the last decade, we, in partnership with the U.S. military, have deployed a little over $1 billion across 300 and some odd companies, innovators, to bring a solution forward, whether it be, again, a diagnostic, biologic, in the area of wound healing, neurotrauma, et cetera. Of that $1 million plus we've deployed, what was very satisfying is the private sector, the non-dilutive dollars, the investor from the venture community, private equity firms, family offices, among others, have recognized the value we're driving. Not only the value we're driving, but the richness of the companies we're funding, hence de-risking that company, de-risking those products, making it very attractive to the private sector to invest. And with that said, over the last 8+ years, the private sector has piled in almost another $1 billion. So for every taxpayer dollar we deployed in partnership with the U.S. Army, the private sector looks at it and says, we're doing something right in terms of being a good steward, identifying a viable technology that has both military and dual use purpose, that it has impact upon the everyday taxpayer. So it's been quite an impressive journey of an eclectic group of people here at MTEC and our partnership with the military. I would like to believe we're doing an okay job at deploying those dollars, picking the right resources to solve a problem, and getting the private sector to pile in. Again, we have about 1,000, almost 1,000 plus companies. We tend to grow it. We tend to widen our vertical of areas that we're going to go after in the biomedical space. And today, I believe it's about 130, 140 some odd companies that are currently under these awards. And those companies are very being sought after by the private sector. So we're excited about this notion and this model of truly an efficient public-private partnership of leveraging taxpayers' dollars, moving it to advance these companies forward, and winning over the hearts of the classic investor to take a position to advance them towards the final goal, and that is either in commercialization of the product and or an exit to a relevant strategic that will further advance these products both for the military and for the private sector.
Yeah, and I think from my experience, that's a differentiator from a lot of other programs who are really, like the SBI programs and some of the other things. You're just getting that initial, commercialization support, research support, but doesn't actually have that second private sector kind of impact factor that is being evaluated.
That's right. In 2026, our strategic goal is to begin to refocus. And just as a side note, just this past week, I'm delighted to share, Chris, that the faith that the U.S. Army has in us, since they renewed our relationship, and we hope to continue that relationships in the decades to come. So
congratulations.
Well, thank you,
it's
sir.
Exciting.
And so we're delighted. We got a terrific team that has really driven this over the past decade. So I'm still the neophyte on the group. But what I'm excited about going forward is to really make this a member first, member centric type of consortium. Why is that important? That's important because the richer and more qualified players we bring on board as part of our members, the more thoughtful and immediate we can respond to the military needs of bringing best of breed technologies forward to address these requirements that the military may need at a minute's notice. So that's a big part of 2026 going forward. Again, our aspirational belief is we're going to like to achieve the best and brightest and a very scaled and large consortium. If you look at that from an investor standpoint, they're looking this as a qualified pipeline.
Sure.
This becomes much more attractive than just serving the military, but it becomes attractive for these companies to be part of our community for the private sector. So that'll be one of the major initiatives is a member first consortium. The other is to further define and be much more proactive. In the past decade, it's been always focused towards our primary customer, and they will always be centerpiece to our mission. However, to ensure their success, the military, we want to be sure our consortium is strong and rich. And now we're shifting some of our focus on the private sector and bringing the right kind of investors to the table and doing some activities right now. We hope to be very efficient and be much more proactive in bringing investors forward as well.
Yeah, well, in this market especially, I mean, we're here at the highest concentration of startups, deal makers, and investors that exists at any time of the year. So bringing investors forward in this market is a real value proposition. Now, as you're growing your members, so I want to understand because I'm sure you're talking to a lot of startups here who are. What does that what defines a member? What's a good member for you? Are there companies out there that are developing technology that they just don't understand that it actually has a dual use application? And you're like, hey, by the way, Army's buying for this right now because there's a gap here. I mean, is that what you're experiencing and you're seeing?
It's funny you frame it that way. We see that all the time.
Yeah.
We see companies coming over the wall defining a technology and innovation, some of their IP, and we'll come back to IP in a moment. And as we sit with them and define it in context of military needs and use, and then we put it in context of what the Army needs at that moment in time. As they put solicitations or share solicitations, which are basically the requirements of a need, we will help further refine that and bring that to this community and work with them. It's a very high touch, white glove approach we try to implement. Because once we bring these companies in, there will be an awardee. But what also comes from this, we've invested time and our own resources and money, not the government's. And that is, we put them into a bucket after we qualify them. So as new requirements come over, we're even more ready and willing and more thoughtful in terms of we've already vetted these stables of companies. So going back to your question, the type of profile, solicitations drive the theme in a solicitation will drive and the requirements will drive the type of companies we need. So some of these solicitations are outside our stable of current companies. So we will actively search and we're putting in processes and enriching those processes of this outreach of the 164,000 biomedical companies that we track, which are not reflected in our website. We actively engage them in a very meaningful way when these solicitations come out. We will literally drive it on a one-to-one relationship when we identify these. Then that segues into another part of our business, so to speak. Not only do we facilitate the advancements and create the awareness of these solicitations to the larger community, there's an instrument or an instrument that was created years ago called an OTA. This is the mechanism and how we work with the military. The OTA is actually a very thoughtful mechanism of how the government can, so to speak, procure ideas and technologies and move them forward. We work under that OTA, but within that OTA, intellectual property and innovation is first and foremost. So we've gone as far to further um, uh, enable these companies that may not have the resources at that moment in time. We put together a toolbox of some very advanced tools on looking at and assessing intellectual property,
Oh, cool.
even to the point where we will engage these member companies as they're bringing forth ideas and help them in terms of invention disclosures, assessment of those inventions, looking at in context of how they would be viewed, whether they're of some value in terms of patent submission. We can dive more into that, but we're offering and providing to that member these tools. Who wins? The all parties. Once again, 360 win. If we understand that intellectual property and we can advance these intellectual properties at a very low cost to enable that company to be competitive in terms of applying for those non-dilutive dollars for the military, again, all
Yeah,
parties
all
win in
parties
that one.
win.
Yeah.
Yeah.
So that'll be another big initiative in 2026. So it'll be in the area of growing thoughtfully our membership base to almost create a new business model, not only to enrich the military, but also in terms of broadening this community. Because what it does, it facilitates collaboration. It also facilitates how the investment community engages us through this very thoughtful way of how we're bringing these members on. Two, in terms of our focus on the dilutive dollars now, in terms of, if you think of it as a bookend, the non-dilutive dollars through our OTA with the U.S. military, and now we're going to, over the last 10 years, doing a reasonable job. Now we're going to create that other bookend, and that is for the private sector then to pick up the ball
Yeah.
and bring these ideas forward.
I must look at you guys as like you're like the center of the bow tie, right? So you've got, you're filtering in the solicitations from the government, and you're creating this little ball of value that you're engaging, you're enhancing, you're
Right.
building. But then you've got the other funnel on the other side, which is what the patients need and investors and getting it out the other side. So it's, you're again in that sense, both sides of the bookends, if you will,
Right.
you're really creating a faster, more efficient system on each side.
We really think that maybe the bow tie analogy is much better than the bookend. We think of the bookend because it's extensible, it's scalable,
Yeah.
and if we can pull that together, again, it further reinforces the monies that are afforded to us by the Department of Defense, taxpayers' dollars.
Well, I
That if
appreciate
they
that.
get the private side then engage, it further reinforces that there's no better metric than are we being reasonable stewards of our money, the taxpayers' money. And I'd like to think the data suggests, as you saw this morning, in terms of help us understand the
Yeah.
metrics of how we're deploying monies and how we're bringing other monies in from the private sector.
Well,
So I'm excited.
not only do we see it this morning in your presentation, but I got to sit down with uh, one of your member companies who was just talking all about. She has 15 government contract vehicles right now, and talked a lot about how you know you're really demystified. Part of what demystified was, and she was early founder, and now they have 15 different contract vehicles for a product that they could really impact
Right.
the warfighter, right? And impact
Huge.
big time, and it's got a commercial impact too, and that's the whole dual use, which I think is fascinating.
Right.
So in parallel, she was talking about her parallel development approach now, with a big support of through MedTech.
It's funny you mentioned that. We assume certain things that players will come in, that they'll be singularly focused. This would be a great product solution for the military, only to realize, and that's part of our outreach and our high touch approach, that in many cases, we quietly work behind the scenes with these companies to make them recognize or at least facilitate the idea that this spills over to the private sector too, or the inverse holds true,
Yeah.
saying that a very viable, scalable product in the private sector at that prototype towards commercialization, saying, my goodness, the military is in need of this, or at least the requirements that are coming forward. Let us begin to position and see if we can advance your company in the most thoughtful way to bring this forward and see if we can put the fuel in it to get it over the hump to that prototype or advanced prototype level. So we
Well,
play a very active role in trying to create awareness of how do we advance this rather than just blindly satisfying a requirement and moving a award forward. So we're trying to always think ahead, saying what is not just the viability of the product, but does it have, as you said, Chris, which is really important, dual use.
yeah. It's slightly turn on the conversation, but we're here. I mean, it's there's been some headwinds the past couple of years. That's clearly, we hear it every day here, and we see the companies raising. Um, the market continues to be challenged, but something that I'm hearing, I'm curious what you're hearing on day one. But I'm hearing a lot of companies and a lot of organizations that have gone through the past, say, we'll call it 30 months or so, and reframed programs and retooled programs. Even investor I was talking to, changed how they're deploying capital in response to kind of the market conditions. It sounds to me like some of the things you're building into it are again a response to kind of how we will be building these companies in the future, how we will be serving the market in the future. I mean, are you hearing some similar things? What are you seeing today in the first day of the conference?
Right. We heard it this morning,
Yeah.
and that is, and it really hasn't changed much really over the decades, regardless of the political or economic climate, excuse me. If anything, this has probably been MTEC's best year in 10 years in terms of capturing thoughtful companies, funding them, satisfying the needs of the military and their requirements. We probably deployed more this past year than we ever have. Matter of fact, in terms of our business plan, we're already well into 2026 already. So there's a need. Now, back to your question, Chris, and here's where the MTech creates a unique dynamic. Regardless of the naysayers out there, when do we invest? How do we invest? What's the criteria for investing? We all hear this, and that is, do they have a product in the market? Where are they at in that product cycle? The strength possibly of their IP, where are they at through the pathway of regulated products, whether it be on a device or therapeutic. Here's what the MTech addresses and cuts right through it. Remember, we're capturing these companies at a prototype stage, not discovery research, a little bit further downstream. We come in with risk money by engaging MTech and receiving that award. We're de-risking these products. So many of the arguments you heard today by the venture community, we've taken that out of the equation. We're setting the stage of a predictable revenue stream. We're setting the stage for a potential exit. We're setting the stage of providing clarity and product definition of a viable, commercial, scalable product. Hence, MTech is a truly and I say this humbly, but I'm excited because of again our audience keeping the trooper healthy and engaged, keeping them in the fight, so to speak, and at the same time having an impact on you and I. With that said, many of the venture groups that we talk to see the MTech model, hence why they gravitate back to MTech, going MTech de-risk innovation. So it was never designed to be this way. I would like to say we thought through this in very meaningful way. But the reality is, this was a byproduct of the MTech. We are de-risking great innovations and making it very attractive to the private sector.
So, Shawn, we got a couple more minutes left. When you think about where we are, start of 2026, we're hearing a lot of different trends. We heard this morning that neuroscience, neurotech is a big trend right now.
Mhm.
Longevity, right? So we heard some from investors. What's really big attention? With the impact that metabolic, the GLP-1s have had on kind of what's of interest and what the consumer will pay. So I've heard a lot about that. I haven't heard probably what you have insights into is like, what are the things that government, or what are the things that DoD or DoW is interested in, and where do you see some of the main sectors that are getting attention right now
Right.
as we look into the new year?
Just again, I can't necessarily, I can validate these observations or
Just
more,
observational, yeah.
more from an observation standpoint. Um, Traumatic brain injury and the just brain injury, whether it be from a diagnostic, a treatment standpoint, that's going to remain very high, I think, on the target list in terms of, and even the byproducts of that, psychiatric help, just general brain behavior and improvement in terms of, and that does have dual use purpose, both for our troopers as well as for the everyday taxpayer. So that's always going to be very high. The other areas that are quite attractive, I think, is in the area of remote medicine, the autonomous hospital, or the idea of gauging and monitoring individuals, whether it be in a hospital setting or whether the soldier being deployed in the field, understanding that health and well-being of that individual. So remote medicine is going to be continue, if not grow. And of course, with the onset of new technologies, artificial intelligence,
I was hoping
and
you'd say that, because I was holding my tongue to say
okay,
AI. So
now,
I appreciate you letting the cat out of the bag.
whether it be artificial intelligence or augmented intelligence to complement the primary healthcare provider, you're going to see more and more of this, I think, because that will segue into remote medicine and really how we triage and how we care for the patient, or just simply care and maintain keeping well people well. And so this will have a big impact. So those are the three areas I think we need to keep an eye on, and we'll
Yeah.
continue to move forward. And then the last one, in a non-regulated way, and that is, you saw it this morning in the area of longevity and aging. And if you look across the landscape on that area, that's not centerpiece of where we are today, but in the biomedical community and where investors are looking, what people often overlook, and this administration is actually pushing it, and that is in the area of nutraceuticals. Some of these nutraceuticals, the rigor of the science behind them, the IRB clinically supported studies, and the impact they may have. If you look at some of the A4M meetings, the line and the clinical protocols, they're rich in nutraceuticals. Now, again, is the military going to engage in this? We don't know, but we see that as an area coming over the horizon, that should we be entertaining these areas, especially with more clinically supported products of that type. We shall see.
Yeah.
But I think the big areas are brain health, remote medicine. How do we better leverage IT platforms in augmented and artificial intelligence? I would put that at the top of the heap of enabling technologies in areas of interest.
Well, and we heard this morning, whether you like it or not, AI is getting funded.
Oh boy.
So, if it's not, it's an AI enabled. As long as have an AI enabled platform and technology, you have to be able to have a conversation around how that impacts.
Absolutely.
I don't know if the government has that same approach. It seems more about impact on the end patient and the end customer. But everything you just mentioned has an AI enabled component of it,
so.
and because we're in this area where data is so much more available to us, and with the new technology tools that are out there, all those sectors can be really enhanced. So I think that we heard that from a couple investors this morning, that you really need to have that part of your story.
And I think and especially in the area of augmented intelligence, profiling patients, and using this as a tool as we profile these patients.
Sure.
Bringing that information forward in context of a treatment strategy.
Yeah.
So it's
exciting times.
It's incredibly
exciting
times. And it also drives outcomes closer to the patient, that they become more responsible and engaged in this journey in terms of keeping well. So there's a number of things we're seeing coming over the horizon, again, in terms of, again, our focus always coming back to our mission, and that is keeping the soldier in the fight, so to speak.
And I'll just we'll start to wrap up here in a second, Shawn. But but keeping your mission and keeping close to the customer and soldier, you're actually moving closer to some of your customer now also. So you guys are moving from South Carolina to Maryland,
Yes.
right? And so you will be closer to at least Walter Reed
Right.
and Fort Detrick and a lot of your customers there.
Dead on, yes. And I'm glad you brought that up, Chris. We are moving this next year to the biotech corridor of Maryland. We'll be closer to our primary customer at Fort Detrick, and we'll have higher engagement there to more satisfy and address their requirements. And of course, that rich biotech corridor where many of our clients are, or I should say our members are. So we couldn't be in a better neighborhood than in the state of Maryland. So we're excited about this move.
And we're excited to have you as a neighbor. So
thank
we'll
you.
probably see each other a lot more.
Okay, thanks, Chris.
And I promise, I'll make sure you're live next time.
Okay.
Sean didn't realize he was live today, so I appreciate you coming in.
All right.
We're here at the JP Morgan week, and there's so much going on, and you and your team have been all over the place here.
We have.
So I appreciate you taking 30 minutes to sit down with me. I know
this is
how
great.
busy you are. Every time I walk by the room, I see you sitting down with a different company.
It's been great.
So I know you're extremely busy out there.
Thank you.
And this has been good. I hope that you all learned some things today. BioBuzz has Maryland is our home court.
Mhm.
So that's where they're. So we have a lot of our audience there. So hopefully you'll be getting to know Shawn and his team a lot more this next year. And so for everybody tuning in, really appreciate it. Shawn, thank you for sharing all your story and insights and everything you're doing to make the QNova LifeSciences and MTEC forum a big success. This morning was great. You guys did an awesome job kicking off. I'm excited to see what next couple of days have in store.
Perfect. Thank you, Chris.
Yeah.
Appreciate the time.
Absolutely.
Thank you.
Great talking with you.
Likewise. Thank you.
Thank you all for tuning in. Make sure you tune back in next week for What's the Buzz?